The Medicare enrollment period is here, and with it brings a lot of questions about the whole process. To get some help for you on this, I talk with Rick Dunlop, the CEO of United Healthcare.
Oh, Tanya, I've got a wealth of information because open enrollment's incredibly important this time because this time of year, extending from October 15th to December 7th, consumers, Medicare beneficiaries across the country have an opportunity to sort of update their benefits to match their changing health and financial circumstances, and they should not miss out.
Yeah, their needs as well. But this program, I find, trying to do this, especially for others in my family, the older that they get, it gets to be overwhelming for them.
Well, it can be overwhelming. What I encourage people to do is not let it get to that point. So you want to remember that original Medicare only covers about 80% of total cost. So Medicare Advantage, by comparison, gives consumers affordable solutions with lots of added benefits. And so this time of year is the time when people want to jump in and take a look at the different options, starting with, is my current plan actually working for me? And even if people look at that objectively and feel like it's working for their health and financial circumstances, they should take a look at the options because, as an example, United Healthcare is lowering premiums across the country, and we'll have roughly 3 million people who will have no premium for their Medicare Advantage plan.
Oh, okay. So are there some key things when you're looking over these plans that you need to focus in on? Because there's a lot of information out there. Is there some key things you should focus on?
Yeah, I encourage people, and I've even told my parents this, to start by making a list of all the medications that you're currently taking, very comprehensive list, as well as the physicians and the hospitals that you want to make sure that you're going to continue to have access to. You want to make sure that you have your best providers, favorite providers there, and then take a look at the added benefits, because what we're finding anymore is most plans include dental and vision, and United Healthcare plans, as an example, some include even coverage for dentures. And so you don't want to pass up on that or miss out on Renew Active or your gym membership, which is going to give you those health and fitness opportunities. And then last but not least, it's going to be the medications, the prescriptions you're going to take a look at very carefully.
So in people who may not have a grandson or granddaughter or a daughter or someone or a son that can help them with this, are there other resources that they can turn to try to help them work through and figure out these choices?
Yeah, so there's numerous resources that are available. And so in this day and age, given where we've been over the last 18 months, things have become a little bit more complicated for people in terms of their comfort with getting out of the home. But if you're interested in just general information, you can check out gettoknowmedicare.com. You could go to medicare.gov, or if you're interested in a specific United Healthcare plan, it would be uhcmedicareplans.com.
That is the best place to get all the information about all the plans that are offered and what each plan gives each person.
Tanya, I'll tell you, I was working on this with my parents over the weekend, and it's tough. I mean, there are aspects of it that are tough, and so I just always encourage people to, make that list, take a deep breath, and look at it as an opportunity to update and upgrade your benefits.
Even he admits it. He's the CEO of United Healthcare, and he's saying it's tough. So if you need some help picking the right Medicare plan for you, you can call the number there on your screen. There is a wealth of information on the websites on your screen right now. And I know firsthand, trying to help my aunts try to figure this whole thing out, I was scratching my head. I'm like, it's so much here.
Well, and sometimes, I love the idea of making the lists of the medications you take and the doctors, because sometimes the cheapest isn't the best for you.
It's not, exactly.
So you got to
you
actually
need to make sure, that you keep what you need and get rid of what you don't. So, very good.